So many wonderful speakers at this event, and so much interest and passion in aging societies. I myself have worked in over 20 health systems in the last 10 years, and every single one of these countries have challenges in aging populations. So it's one of the most important topics, I think, today. So that is why I'm also excited to present the UK's experience in addressing this topic. So let's dive in. So why is aging important? You know, aging is inevitable, but what's key is how countries prepare for this. Because a longer life can bring a wealth of opportunities. Not only more time to spend with loved ones, but also to pursue new career prospects, retrain, follow hobbies, and also make important contributions to family, communities, and the economy. I have seen in communities in Beijing, for instance, how older populations come together to express their interest of culture, communication, and friendship. And that is something that's really lived with me in my experience in Beijing. So we in the UK talk about this in terms of healthy aging. It's about maintaining functional ability and well-being as people age. And why is healthy aging a challenge in the world today? The global population is growing older, and the pace is increasing quite rapidly. In 2019, the United Nations World Population Prospects Report projected that by 2030, the number of people aged 60 and over will be 38% of the population, so going from 1 billion to 1.4 billion. So the UN themselves have warned that many countries' health systems are also not prepared for this challenge, and that we need to work together in finding new solutions to this. And in recent years, the life expectancy in the UK has also increased significantly. Like many countries, the UK is facing challenges of the aging population. And a lot of this is around long-term conditions and multi-morbidity. So 75% of people aged 75 in the UK are going to have multiple long-term conditions. So this is the challenge for us in our health system. And to address that challenge, we have launched two strategies, one for our health system and one for health industry and research. So the first strategy, which is our health system, last July, we launched the NHS 10-year plan, which sets a bold vision to become a modern, sustainable NHS, or National Health Service as we call it, that delivers better care, faster access, and healthier lives. We have the oldest universal health coverage system in the world, but we also recognize that this needs to go through an evolution. And this evolution focuses on three big shifts. The first shift is hospitals, communities, bringing care closer to home, reducing pressure on the hospitals. The second shift is going from analog to digital, using apps, big data, AI-driven tools to deliver care in all settings. And then finally, sickness to prevention, tackling things from obesity, smoking, mental health, and expanded screening, so we identify these issues early. And what does this mean for aging populations? Firstly, it means treating illness to prevent decline. We are reframing frailty as a long-term condition that can be managed early. We want to reduce the time spent in poor health and focus more on prevention and self-management. The second is care moving closer to home. So we are developing integrated community-based care, keeping older people outside of hospitals, developing new health services in the neighborhood, providing proactive and multidisciplinary workforce and support. Connected to this is a national workforce plan focusing on delivering for an older population. So making sure that our health systems, nurses, doctors, community support workers have the skills and capacity to take care of more complex older population diseases. And then finally, something that obviously China is very interested in is tech-enabled independence, digital access, remote monitoring, AI-assisted diagnostics to spot problems early, but also to support aging at home. So that is our health system strategy. The next is our health industry and research strategy. And again, this year we launched the Life Science Sector Plan, which is part of the UK's modern industrial strategy, very similar to the 15th five-year plan, which sets out a 10-year mission to harness British science and innovation to deliver long-term economic growth, but a stronger and prevention-focused national health service. So, for instance, the UK is already a global leader in life sciences. Our sector is worth £100 billion to the economy, and we have 4 of the top 10 universities in the world for medical science. And we also have companies like AstraZeneca and GSK, who are already global pioneers, including in the UK, delivering next-generation innovation. However, we want to accelerate that. By 2035, we want the UK to be the 3rd most important life science economy in the world, only behind US and China. So the government has a very bold plan of life sciences which focuses on transforming our silver industry, but also delivering those innovations quickly to our health system. And this focuses on 3 areas. World-class research and development. You cannot have solutions of the future unless you're helping your R&D sector. We want to make the UK an outstanding location to start, grow, and scale and invest. And we have almost 25 Chinese companies with significant presence in R&D in the UK. And then driving health innovation, but also health system reform at the same time, doing it together so that we can develop and evolve quickly. We want the UK, for instance, to be one of the top 3 places in Europe for patient access to next-generation medicines and also medical devices by 2030. And for aging populations, both of these strategies, they unlock data, they unlock speeding up clinical trials, they unlock scaling genomic medicine and AI to develop more personalized care. And it's being deployed in the National Health Service to directly improve the lives of aging people. And it's not just strategy, it's also pathway. You know, as we age, we go through a different sort of circumstance where our care and our sort of treatment needs to be looked at. The focus for the UK is about empowerment and independence. And this pathway demonstrates how we develop expertise and solutions across the aging cycle, which revolves around services, solutions, and product innovations. I'll just quickly go through this journey. The journey starts with, as I said, promotion, health promotion and prevention, focusing on preventing illness, promoting health through public health initiatives, education, community programs. So, for instance, we have developed initiatives like Active Aging, which promotes physical activity and healthy eating in older populations. We've developed screening programs such as the NHS Health Check, which gives assessments for free to individuals aged 40 to 74. And we also have done vaccination programs, giving immunizations for influenza, for respiratory diseases, for shingles. We're trying to do that prevention at an education level, but also at a science and treatment level as well. The next part of the pathway is assessment and diagnosis. So the UK has an integrated health service looking at early detection, but leveraging pioneering technology to identify common conditions, but also the diseases that really matter to our health system, such as cardiovascular disease, cancer, and dementia. And it includes a really strong primary care system. So making sure that we have a strong primary care assessment system where GPs are the front line of identifying health issues, but also can then refer to specialists further down for further assessment and diagnosis in our local community settings. The next part of the pathway is treatment pathway. So eventually, we all do need treatments for diseases that occur. And this pathway looks at bringing next generation therapeutics to those that need them the most. The UK is a leader in converting areas such as neurological research into later treatment and bringing those breakthroughs into our health system. So, for instance, using genomic medicine to personalize medical solutions in areas such as cancer. And then finally, the longer-term care pathway. Looking at the longer-term care looks at chronic diseases, looks at disabilities. It looks at home care and residential care, looking at 24/7 support and specialized care in these settings, which this conference obviously has a lot of organizations delivering for. But we also have organizations such as Age UK, non-governmental organizations that look at social activities, transportation services, caregiver support, making sure that we can still give an element of independence to our older populations, but in a coordinated care system that's comprehensive. So in summary, our system is looking at a more consumer demand-led system. How can we tailor our system to make sure that we're listening to the older population, where we can deliver areas from promotion all the way to longer-term care in a comprehensive strategy? And these sorts of, this pathway would be nothing without how we accelerate innovation. And the UK is looking at next generation life sciences to empower that system as well. So I'll just give 3 examples here. One area we're doing this is leading global clinical research and trials. So for instance, the UK and the Wellcome Trust, which is a data genomic organization, is investing £600 million to create a health data research center, transforming access to NHS data for international organizations to conduct better clinical trials and develop aging therapies. We're also tackling healthcare challenges through medtech, so adopting wearable technology quickly, enhancing older patient engagement, really empowering healthcare professionals and patients in wearable technology. And then finally, powering AI and tech bio to transform life sciences. So for instance, we've developed the AI Opportunities Action Plan, which builds on UK strengths, bring in international expertise, and develop a consistent infrastructure in areas such as diagnostics, imaging, and data management for aging diseases. So I've talked a lot about different strategies and pathways, but I think if you're going to go away with one sort of graphic of what the UK's sort of approach to aging is, it is this. And you can see how the patient, the older population, is at the center of this. Well-being is the focus, empowerment is the focus, and then health system, industry, and academia forming what we call a triple helix to develop research, services, innovation, products for the silver years. And within that, the silver industry as well, which a lot of Chinese companies exhibiting today are part of. And it's not just medical professionals and the such. It's also smarter cities. It's also environmental health. It's also research and development into solutions, into other products such as consumer health, better nutrition, assistive technology. All of this forms a circle around the aging group. And a bit of an indicator of how our success is now translating, the 65 to 75-year-old age group in the UK is the most satisfied, is the most happy of all age groups, according to a recent report. So you can see how the system is starting to give a benefit. And then finally, I'd just like to end with an example. I mean, a lot of you know about AstraZeneca and GSK, but we have a very fledgling group of SMEs or small and medium organizations. And one company called ACT Good has a UK method translating into a China-ready product already, which focuses on assessment, really developing a scalable workflow tailored to China's aging service. And this is already being localized in Chengdu. And basically, it's a digital health solution where community-based workforce can assess the needs of an individual rapidly. So every need that a local sort of aging population needs, and then giving that information and that data to help to allocate resources for local governments, local hospitals, even local companies to make sure that you're delivering in the area that they need the most. So you can see how resident focused care, population level service can really make a difference as well, especially in the era of lower resources and the need for better efficiencies as well. So I'd like to just conclude by saying, you know, the UK government is here. We're here to collaborate. We're here to cooperate. We're here to work with you in areas such as policy, all the way to industry, all the way to research. Do use us as your gateway to the UK and the best of what we can offer in terms of products and services. And I really hope that I can meet you again in the future. So, Cecilia, thank you very much.
好，我们非常感谢安瑞辉参赞为我们介绍的英国健康老龄化的路径和它的创新方法。下面呢，我们有请湖南省民政厅养老服务处的叶建之处长为我们带来“全力打造三乡颐养养老服务品牌，让老人身在湖南，养老不再难”这句朴实的口号。 背后是湖南省在养老服务体系建设上的扎实探索。他们坚持顶层设计与基层创新并重，系统构建了三乡颐养服务体系，推进县乡村3级养老服务网络的建设，培育居家、社区与农村互助等多元形式，从老年助餐到适老化改造，正将养老不难从愿景变为现实。我们掌声欢迎叶建之处长。
你可以用这个，也可以用鼠标啊。我就拿稿子的，我就拿稿子。他们有人跟我放照片吧，在底下。那个给我来放 PPT 的邀请啊。各位领导、各位来宾、养老服务业的各位同仁，大家上午好！非常高兴能与大家相聚在 第12届中国国际养老服务业博览会，受曹忠平厅长委托，下面由我代表湖南向各位领导汇报交流湖南推动养老服务发展的3点做法和体会：一、聚焦养得了，健全多层次养老服务网络。 3乡4水，伟人故里。湖南是一片充满温情与活力的土地。当前，湖南已经进入中度老龄化社会。2025年末，60岁以上老年人达到1605万，老年人口占比达到了24.72%，其中失能失智老人 有300多万，65岁以上老人有1094万，老龄化的形势非常严峻。习近平总书记指出，一个社会幸福不幸福，很重要的一点是看老年人幸福不幸福。近年来，我们湖南认真学习贯彻习近平总书记 关于养老工作重要指示批示精神，实施积极应对人口老龄化国家战略，着力打造三乡颐养服务品牌，持续提升养老服务质量，丰富养老服务供给，让老人身在湖南，养老不难。我们以重点民生实事为抓手， 着力织密养老服务网络，强化兜底保障，确保养得了。一是织密养老服务网络，以县乡村3级养老服务网络和城市15分钟养老服务圈建设为重点， 每个县市区都建有1所以上失能集中照护机构，每2到4个乡镇街道就有一个区域性综合养老服务中心，建设村社区养老服务站点1万多个。下一步，我们还将重点推进社区嵌入式养老机构发展3年行动，让专业服务离老人更近一步。2是抓实重点民生实事，连续将养老机构护理型床位建设、认知障碍时光守护床位建设纳入省政府重点民生实事，建成护理型床位数量15.8万张，着力破解一人失能、全家失衡的民生痛点。“14·5”期间，我们湖南已支持16.51万户特殊困难老年人家庭适老化改造，建设家庭养老床位3.3万张，居家上门服务200万人次，着力解决老年人居家难题。3是筑牢安全发展底线。“14·5”期间，我们省市县3级财政投入10亿，加强养老机构消防设施建设，推动1800余家养老机构全部通过消防审验，消防设施操作员的持证率也大幅提升，建立了省、市、县3级和机构互联互通的安联网，安装4800多个物联网传感器，累计预警8000多次，切实守护好老年人生命财产安全。2，聚焦养得起，不断深化养老服务改革创新，大力推动养老服务补贴政策落实落地，实现服务价格可承受，服务供给更多元丰富，确保养得起。1是构建多元参与机制，坚持降成本、扩供给、促消费协同发力，开展乡镇敬老院县级统管改革，降低公办机构运营成本，让基础服务更普惠，鼓励家政加养老、物业加养老、多元业态发展，通过市场竞争让服务价格更合理，开展焕新惠老消费补贴，带动适老化改造产品销售1.5亿元，惠及超过4万户家庭，有效释放了养老消费潜力。2是用足用好消费补贴政策，全面落实中度以上失能老年人养老服务消费补贴政策，已有超过11万名老年人享受养老服务消费补贴，发放补贴1.4亿元。下一步，我们还将把家政、物业、护工等多类企业纳入社区居家上门服务范畴，把宣传做到社区，做到老人家里，让好政策真正惠及更多老人。3是深化养老服务改革创新，鼓励各地因地制宜，积极探索养老服务新路径。比如我们岳阳汨罗市3住互助养老模式，让农村老人不离乡土就能享受照护服务，入选全国农村公共服务典型案例。娄底市创建乡镇统筹、村齐牵头、老协实施、家庭尽责4位一体的互助养老模式，减轻农村养老负担。比如长沙市望城区打造了养老加信用模式，让诚信老人享受优先优惠。3，聚焦养得好，统筹养老事业产业协同发展。 紧紧围绕服务有品质、安全有保障、精神有寄托，着力推动养老服务提质增效，确保养得好。一是着力推进产业融合发展，充分发挥湖南文化底蕴深厚、康养资源丰富的优势，积极推动养老与医疗、文旅、农业、金融等产业深度融合。比如衡阳市依托南粤寿文化，开通银发旅游专列，打造候鸟式旅居养老标杆。常德市建成康养产品展示馆，布局银发经济产业园。再比如郴州市开发了生态康养、温泉疗愈等特色线路。二是强化养老智慧赋能，加快推进3项颐养智慧养老综合平台建设。我们推动大数据、人工智能在养老服务领域的深度应用，大力推行养老机构标准化建设，实施一床一码动态监管，积极运用智慧助餐、远程问诊、紧急呼叫等科技手段，让养老服务变得更加智慧、更有温度。再比如衡阳市区块链加养老入选了国家创新应用试点，郴州市入选了全国基本养老服务综合平台试点。三是建强专业服务队伍，建立了省、市、县3级培训体系，每年安排不少于1000万元的专项培训经费，年均培训超1万人次，指导市州推行护理员双证上岗制度，建立了护理员岗位补贴，根据技能等级每月补贴200到600元的补贴制度，推动提高养老护理员持证率，养老服务专业化水平大幅提升。四是丰富精神文化关爱，依托湖南电视台爱晚频道和5位一体宣传平台，为老年人提供丰富的精神文化产品。全省已建成全国示范性老年友好型社区136个，发展银龄志愿服务队伍8500余个，引导120多万名老年人参与公益服务，让老年人老有所养、老有所为、老有所乐。养老服务是积善行德、大爱无疆的光荣事业，也是潜力巨大的朝阳产业。我们湖南省委省政府高度重视养老服务事业产业的发展，我们也诚挚邀请全国各地的养老服务同仁、企业、专家学者来乡交流合作、投资兴业，共同谱写3项颐养高质量发展的新篇章。同时，我们也热情欢迎老年朋友们到湖南旅居康养，亲身体验身在湖南养老不难的温暖。最后，预祝本届博览会圆满成功，祝各位领导、各位来宾身体健康，万事如意。谢谢大家。
谢谢叶处长，谢谢您，谢谢叶处长为我们带来了湖南的养老新模式。那么荷兰呢，作为全球失智照护的标杆国家，以霍格威失智村模式与国家失智症战略闻名，其去机构化、以人为本、隐形照护的理念深刻影响着全球的养老领域。那么接下来，让我们有请荷兰王国驻华大使馆卫生福利及体育参赞雅尼兰女士，为我们带来从体系到实践 荷兰在养老照护、失智照护方面的经验的演讲。我们掌声欢迎。
Distinguished guests, ladies and gentlemen, dear colleagues, it is a real pleasure to be here today at this China International Senior Services Expo in Beijing and to have the opportunity to contribute to the Dutch experience to this important conversation on the future of elderly care and healthy aging. My name is Joanneke Kraan and I work at the Dutch Embassy here in Beijing as the Counselor for Health, Welfare and Sports. Let me begin by setting out a few figures because they help us understand the scale and the urgency of the things that we are discussing today, despite our countries are tremendously different from each other. Because in China, population aging is advancing rapidly. More than a fifth of the population now is already aged 60 and older, nearly 300 million people, and this number, as you all know, is continuing to grow significantly year by year. And in the Netherlands, we are a very, very small country. The situation, its scale, is quite different. We have a total population of only 18 million people, but despite our difference in scale, we see a very, very similar direction. Today, even more than 20% of our population is aged 65 years and older. And this share is expected to increase further to around 1/4, so 1 in 4 people of the population by 2040, according to the statistics from our own Statistics Bureau and also from the European statistical projections. So while the demographic scale is different, the underlying reality is the same. And that brings us to a fundamental question, which is really at the heart of today's talks, I believe. Because it's not only how we help people to live longer, but the question is also how do we ensure that those additional years are lived in good health, with dignity, but also with a sense of independence and also belonging and connection. So having said that, I would like to share with you some of the Dutch concrete positive examples and models of elderly care and dementia care. But before doing so, I think it's important to briefly introduce to you the Dutch system to give you some context, because understanding this framework helps explain the practices later on in my presentation. Elderly care, you must know, in the Netherlands, it's built on a number of coherent and interdependent laws, policies, and also national strategies. The first is the Social Support Act, which is focusing on participation of people, prevention, and community, basically community-based support. You may best compare it with the work that Civil Affairs is doing in China. The main goal of this act is to enable elderly people and individuals with disabilities to live independently at home for as long as possible, and also to participate in society according to their abilities. The second is the Long-Term Care Act, which covers people with high and continuous care needs, often in intensive care settings and also nursing homes. The Long-Term Care Act in the Netherlands is designed to provide high-level 24-hour care for vulnerable elderly people or those with severe mental or physical disabilities. And third is our Health Insurance Act, which ensures universal access to medical care through regulated competition among insurers and healthcare providers. Now, it's important to note that these acts I've just mentioned, they complement each other. And there is a strong focus in each and every one of them on prevention and welfare, as well as on community care. We aim to make this aspect stronger. And then I'd like to mention two strategies, additional strategies, next to those three acts, because they're relevant for the elderly care system in the Netherlands. And one important direction is what we refer to as the National Framework Elderly Care, which was adopted just last year in December by numerous parties, including governments, local, national, but also insurers, elderly people themselves, and non-governmental organizations. And the aim is actually to maintain a sustainable workforce, while at the same time, by using maybe technology, AI, we've heard it numerous times already in previous speeches, we need to create a sustainable, future-proof, and more person-centered healthcare system. And another direction relevant to mention here is the National Dementia Strategy 2030, which emphasizes also on prevention, early diagnosis, treatment, and integrated care pathways, as well as long-term support for both patients but also the caregivers around patients living with dementia. We believe that people with dementia and their loved ones, they should function as valuable members of our society and receive good support and care. So, across all of those acts and frameworks I've just laid out, one clear direction has emerged over time, and that direction is a shift away from institutional care as a default toward care that is organized around people's lives. And that brings me to one of the most important developments in the Dutch system, which is the shift towards care in the home and in the community. These are numbers I've shared. I will skip this slide. Oh, sorry. So this was the elderly care agreement I was just telling you about, and the National Dementia Strategy. And now we move to a number of concrete examples I've wanted to share with you today about the Dutch healthcare system. So because today a significant share of elderly care is delivered at home, supported by general practitioners, community nurses, and also local service networks, which are kind of neighborhood teams consisting of nurses but also social workers. And the underlying idea is quite simple, namely that most people prefer to remain at home in their own homes and communities for as long as possible, and they want to maintain their independence, their routines and their social environment. And this is possible, we believe, with the appropriate support and care that complements what older people and their network can and do and want to do themselves. Now, a very important pillar of the Dutch healthcare system is the central role of the general practitioner, the GP. My colleague from the UK also mentioned this already.